Welcome and thank you for joining today's discussion. I see a number of folks joining in, and we want to make sure we start to dig into the content for today's discussion. So I know we'll have others attending as we get rolling. My name is Sarah Morris Compton, and I am from the Family Wellbeing Strategy Group at the Annie E. Casey Foundation. I'm excited to share some of the great work done with leaders in New Mexico that the foundation had the pleasure of supporting in recent years. The Annie E. Casey Foundation is a private philanthropy that builds a brighter future for the nation's children and youth. We want to make sure that all young people have the family connections, relationships, community, and educational and employment opportunities that they need to thrive. We seek to advance racial equity in all that we do because we know that children and families of color often face the greatest barriers to success. The work of the Family Wellbeing Strategy Group within the foundation is focused on ensuring that all children and youth in the U.S. from birth to age 26 are safe, healthy, and equipped to thrive together, free of unnecessary child welfare system involvement. Our work with New Mexico is one example of a system reform engagement aimed at advancing that high-level result. The foundation began an engagement with the Children, Youth, and Families Department in 2019 with the shared goal of expanding support and services for the well-being of young people involved in New Mexico's child serving system. At the foundation, we often seek to invest where our contribution supports government and communities as they expand and sustain the resources available to young people and their families. As part of this engagement, we funded the Public Works Alliance to partner with New Mexico, along with Optimas Services, exploring their Medicaid claiming opportunity and then implementing a strategy for responsible maximization. We did this because we know that nationally, child serving systems are often in resource-limited realities and striving to make dollars go as far as possible to best serve children and families. A key part of a successful fiscal strategy is ensuring that states are appropriately pursuing all available federal reimbursement. Medicaid can be one vital component of this, and today's discussion will center on maximization of Medicaid administrative claiming in the New Mexico Children, Youth, and Families Department. We are thrilled that some of our partners from New Mexico are in attendance today as we highlight their extremely successful work and help to share it with other jurisdictions. As time allows today, I will select a few questions from the chat for our presenters at the end. Please use the chat function to post your questions for the presenters, and we will get through as many as time allows today. And we will share written answers afterwards for those questions that we don't get to today. With that, I'll introduce our presenters. Alex Briscoe is a principal at the Public Works Alliance, which is a collaborative of policy experts, system leaders, researchers, and advocates that aim to create stronger, more equitable public systems. And Patrick Sutton is president at Optimas Services, providing consulting solutions to government agencies and community-based organizations engaged in leveraging state and local dollars to draw down federal reimbursement. So with that, I'll hand it over to Alex and Patrick, who will walk through the slides.
Thank you, Sarah, and welcome, everyone. We're going to take you through a journey that we hope everyone will understand and see their work in the context of. And I can say, as someone who led a large public system for many years, that one of the fundamental truths of public systems is they don't have enough resources, particularly discretionary resources, to do the type of systems change work that they want to. And so we want to talk today about how child serving systems can access these dollars creatively to do the kind of work that they want to do. I also want to acknowledge the extraordinary leadership of the Children, Youth, and Families Department in New Mexico and the collaboration of the single state agency, the Human Services Department in the state of New Mexico, for their collaboration and willingness to think creatively about how to get more money. It's very important to say here that we are so grateful for the support of Annie E. Casey and the state of New Mexico. And this is our stuff, you guys. So you're going to hear the reflections and the very specific outcomes of a project that Patrick and Alex and many others worked on, particularly the finance staff at CYFD. So this does not represent the opinions of anyone other than those of us who did the work. So let me just go right to the end and cut to the chase here. To make a long story short, just 2 units of the Child, Youth, and Family Department of the state of New Mexico increased their federal revenue by $4 million annually. So literally just 2 claiming units. And what we want to show is how this work could be understood and exported to other child serving systems. And we're going to take you through the detail of it, exactly how we did it, who we talked to, the steps in the process. But before we do that, I want to invite everyone to see the forest through the trees and to sort of see Medicaid as an opportunity to generate additional revenue on what you're already doing. And that's the key takeaway today. And we'll show you how we did that in 18 months to the tune of $4 million for New Mexico's CYFD department. So let's do a little background. New Mexico is extremely poor. Almost 3/4 of children are born into their Medicaid system. Some of the data you see on this slide is heartbreaking and challenging. And like many public systems, New Mexico is largely reliant on sort of boom and bust cycles of public revenue, in this case tied to oil and gas, but in many other states and jurisdictions, those of you listening probably are familiar with this challenge of when the economy turns against us is when we need the services of our public systems the most. And you can see from this data that there are some really heartbreaking data about what it is to be a child in New Mexico and how challenging the circumstances that CYFD works in are. 49th in the nation in poverty. But through some leadership from past administrations and existing administrations, the Child, Youth, and Family Department of the state of New Mexico has had some really important and progressive priorities. It includes both behavioral health, child welfare protective services, and the juvenile justice division, and all services related to kids in detention. So CYFD is these 3 services together, the public system of behavioral health, child welfare, and juvenile justice. And its leadership made a commitment to doing some things really in new and creative ways. The leadership there really wanted to expand access to community-based mental health services, saw that mental health services could directly impact the life outcomes of young people across their system. They wanted to implement performance tools agency-wide. They wanted to improve the depth and sophistication and quality of their public service. They were very committed to alternatives to congregate care placements, and they were very much struggling with the impact of the Title IV look back. And if you don't know what that is, basically, fewer and fewer children in foster care are eligible for 4E based on this thing called the 4E look back. So for those of you here who may or may not know this tension, 4E and Medicaid are both ways to pull down federal matching funds, and the percentage of children eligible for 4E is shrinking. In some states, it's only 50% of all kids in foster care. So the key thing to understand about this very specific project is we played on what is called the administrative side of the Medicaid program. And many of you know what Medicaid, it's one of the largest programs in our nation, created in the 30s, amended in the 60s. It's a health insurance program for low-income communities. And children are eligible in some states from 138% of federal poverty or living with an adult who makes less than $19,000 a year. But in other states, Medicaid has incorporated its S-chip program, and young people are eligible up to 266% of federal poverty. So every state is different, but Medicaid eligibility is a huge factor in child serving safety nets. In many states, half of all children are eligible for Medicaid. MAC is a function of Medicaid, but a distinct program. Medicaid generally pays for things like a hospital bed or a pharmacy, getting medications, or an ambulance ride. But there is a whole other set of things that Medicaid pays for that are for the necessary and appropriate administration of the Medicaid program. And it's not for direct services, but it's things for like linking people, educating folks, developing a program planning and policy development, outreach and enrollment activities. All the things that you have to do to get someone to a service are what we call the Medicaid administrative claiming world. And I will try to distill for everyone here Medicaid 101 in one slide. And it's actually a pretty simple thing. every Medicaid expenditure, whether it's direct service or administrative claim, distills to two parts and two parts only. The first part is called a certified public expenditure. This is a fancy name, and this is really important, everyone. It's a fancy name for a non-federal dollar that isn't already being used to match a federal dollar. Okay, I'm going to say it one more time. A certified public expenditure is a non-federal public dollar that's clean, that's not already being used to match a federal dollar. You could distill my career to hunting for CPEs. And that's the encouragement I would offer everyone today, is think creatively about where you or your administration is spending non-federal dollars, and where you're spending them, think, could it get matched? So that match is called federal financial participation. So every Medicaid expenditure has two parts and two parts only: a CPE, a non-federal expenditure, and the federal match associated with it. Together, they equal a Medicaid expenditure. Pretty simple, right? Like, one way to think of Medicaid is a pot of gold sitting in DC. To get a dollar, you put up a dollar and follow the rules. So how do you participate in MAC? And the delightful thing about Medicaid administrative claiming is that it's really easy to participate in. In fact, you don't have to be what we call the single state agency. You can be anyone who works with low-income populations, helping them connect to the services that Medicaid funds. So staff across your child serving safety net are eligible for MAC reimbursement by tracking their time and categorizing it. So really important to hold that MAC is not associated with an individual beneficiary, it's associated with time on task. In New Mexico, there are 12 activity codes. Some are reimbursable and some are not. Here's the list of 12. 4 are reimbursable, and these are the 4 essential ones that we hone in on and try to teach jurisdictions to focus on. The first is outreach, time spent educating and informing individuals about the Medicaid program. The next is referral coordination and monitoring, time spent following up with someone to see if they got to that service, if they knew about it, was it any good, did they get what they needed? And time spent studying what's going on with you. Hey, how you doing? Kind of like care coordination and case management light. Medicaid eligibility and intake. Are you helping someone know if they're eligible for the program and enroll? And then arranging transportation. So these are the 4 reimbursable codes that are really the heart of the revenue code game, but you have to code your time to all 12. And what we discovered quickly was that New Mexico's Department for Children and Family was on the front lines of connecting Medicaid eligible families to Medicaid services. In fact, just about all of the kids being served in juvenile justice and foster care and behavioral health were Medicaid eligible. And the CYFD's team and leadership and frontline staff were doing critical and essential work connecting these low-income communities, children and families, to the benefits that Medicaid paid for. And we discovered that CYFD was spending significant CPEs, meaning significant non-federal public dollars where no match was being generated. And that's really the key essential opportunity analysis for all of you listening. If you're spending state general fund or sales tax or assessment dollars or vehicle license fees or public dollars that aren't from the feds, but originate from your state or local jurisdictions, those are CPEs. And we discovered that CYFD was spending hundreds of millions of them. So what did we do? And I'm going to do the broad overview of this 4-step plan, and then I'm going to pass it off to my beloved friend and ally of many decades who taught me this work while I was leading a public agency, Patrick Sutton. The first thing we did was an opportunity analysis. We looked for those CPEs, meaning were young people, was the agency spending the right kind of money, and were they doing the right kind of work? The next thing we did was we developed an initial strategy that we were not wedded to. And this is really important. If you notice here between 2 and 3, there's a circle here, a feedback loop, which means once you have a strategy, it's really important not to be imprisoned in it, because you must test it out in the real world context of the staff and stakeholders who will be running it and working on it. So we developed a strategy, we tested it with leadership. And again, I want to acknowledge the willingness of CYFD leadership and staff who are on this webinar today to engage in this work, to stick it out, to learn, to retry, to do it with us. And we developed our strategy, we tried it out with staff and leadership, we refined it, we improved it, and then we did the work. Specifically, we created a claim plan, we tracked time, and we submitted it. Patrick, I'll pass it off to you.
Hi, good afternoon, everybody. Patrick Sutton, it's very nice to be with you guys. So initially, when we were working on this with CYFD, and I want to emphasize from the beginning, there is no success here without buy-in and participation, active participation with CYFD, both the leadership and the management and the line staff. They were wonderful to work with. So initially, what we started with was we were looking at what is in place currently. They had an active MAC claim. They had about 8 or 9 participants who are on the behavioral health side. And so we looked at that. We took a look at how they've been claiming. They've been using Excel spreadsheets to track time. We had looked at 2 years worth of claims. So that was important for us to get the lay of the land initially. Then it was vital that we looked to see what the potential growth was in terms of additional reimbursement by adding additional staff within the behavioral health unit and then also within the juvenile justice unit. That was a real expansion. The uptick in FTEs on the juvenile justice side was from, we were starting from scratch, from 0 basically. Behavioral health, we were starting from about 8 or 9 and moving up to around 75. So and then what we also wanted to make sure and do is, because this MAC claim with about the 8 or 9 participants had been in place for a number of years, we wanted to see if there were audit vulnerabilities, where those vulnerabilities lie, what they could do to mitigate those for future potential audits by the Centers for Medicare and Medicaid Services, CMS. So we wanted to take a look at 2 basic documents. This governs how Medicaid is claimed in many, many states, the Medicaid state plan, and in the joint powers agreement. We ended up emphasizing and spending more time in the joint powers agreement, primarily because that is where the Medicaid administrative claiming program guidelines, rules, regulations, they were live. And we went back, we looked at those. They had been approved by CMS back in 1995. They hadn't been updated at that time. So we went through, we wanted to make sure we had a good understanding of the architecture for Medicaid claiming, specifically administrative claiming. Additionally, we did a targeted case management assessment as well. Targeted case management is another claiming program, and that was the one where we were really focused on an existing state plan amendment for targeted case management. So that's more where the SPA came into being. All right. All right. So what we did in terms of the how and the how much, we spoke a little bit about the state plan amendment, the SPA for targeted case management, the joint powers agreement, more in tune with the Medicaid administrative claiming program. Really what we did as we went through our analysis is we found that there was potential growth to over 200 employees spread amongst both behavioral health and juvenile justice. It was vital that we went through a couple of steps with them. We had to go in, we did interviews, we talked about what people were doing on a day-to-day basis, and we came up with basically a potential claim from the MAC side for a combination of behavioral health and juvenile justice of around $2 million. We also did an analysis on the TCM side, which would have been specific to the juvenile justice folks, of another $2 million. Just so that everybody's aware, our focus today and where we really implemented was on the MAC side. The targeted case management program is still available in New Mexico for the juvenile justice folks. It's a question of sort of putting the work and establishing the infrastructure and getting that going. And that may be something they choose to do at a later date. So when we were looking back at historical information, we looked at prior year invoices, we looked at prior year time studies and other audit documentation. And we did find some vulnerabilities from previous years. that is something that we sort of dug into, and we developed a report and shared that with CYFD. One of the things we wanted to make sure was, as we moved to an additional huge growth and really MAC participants, that we were as rock solid as we could be from an audit standpoint. And that's one of the reasons that we were recommending they move to a perpetual timekeeping approach, a methodology, that we were going to sort of flesh out additional administrative activity codes that they could utilize. And also from an audit standpoint, if you look at that third check mark, that's the missing SPMP staff certifications. Really what that stands for, skilled professional medical personnel. Within the MAC program, if you are a licensed clinician and you are doing some types of MAC activity codes, you can claim at a higher reimbursable percentage. What comes along with that is you need to have licensure certifications and supporting documentations to prove that license is active when claiming. So again, really sort of focusing not just on the potential to grow the claim, but also to ensure that those audit documents are ready and prepared in case of a CMS, or for that matter, a single state agency at the state level audit.
So let me jump in with a couple important takeaways for those of you as we sort of dive to the details. Let's lift it back up a little bit again. In order to pursue MAC claiming in your jurisdiction, you have to understand the architecture of Medicaid in your state, specifically who the single state agency is, and if you're in the child welfare or juvenile justice space, what your relationship with that agency is. And that's where the joint powers agreement was so important to us, is we were able to go look back in history and see how CYFD was in relationship formally with its Medicaid agency, what we call the single state agency. So you can't do this work unless you mine that architecture. We did a comprehensive analysis of all revenue streams, acknowledging fundamentally that not every dollar is the same. Next click. Because you must be able to distinguish what is a CPE and what is not. So when you look at your budget, understanding all of your revenue and its origins is essential to this work. And that means distinguishing between state general fund, federal, and philanthropic sources. This is literally the essential task for the opportunity analysis, is what comes from where. And then, of course, doing that kind of cost benefit analysis between the traditional claiming mechanisms of 4E, which are increasingly being constrained by the look back, and the opportunity to look at MAC. So you don't necessarily want to abandon 4E, but you maybe want to look at the opportunities for MAC in the context of the look back. Thanks, Patrick. Let's keep going back into the detail.
All right. So, looking at the steps that we took and really looking at one of the most important things we wanted to implement as we moved to a larger number of participants was really shoring up the time tracking process for the MAC claim, specifically, again, for juvenile justice and behavioral health, which are two of the units that are in CYFD. And so one of those areas was really having a rock solid time study approach. We wanted to make sure that the time tracking was both prepared and ready to be compliant with all things federal and state, but also we wanted to make it efficient and not overly burdensome on the participants themselves. And so that's one of the reasons we wanted to move to an electronic timekeeping system where folks could actually access it as long as they had the internet. They could go through their smartphone, they could go through an iPad, they could go through a laptop and track their time accordingly. Additionally, we wanted to make sure that would only take, at the end of a week, maybe if you were add up all the time that a participant spent putting their time into these activity codes, it would take 15 minutes or somewhere around several minutes a day to get that done, preferably tracking their time at the end of the day. And then using this electronic timekeeping system would be a lot easier and less burdensome than using like an Excel spreadsheet. So that was our focus. So that was the time tracking software piece. We streamlined that. The second part to it was really looking at the available activity codes. We really wanted to beef up and make compliant with the federal guidelines for the MAC program, where there are a number of reimbursable activity codes. We don't need to go through them all today. I know that Alex mentioned several of them. They're highlighted there. Medicaid outreach, referral coordination, monitoring of Medicaid services, others as well, including utilization review, quality assurance, and program planning. But we wanted to make sure that we not only identified them and made them compliant with the federal MAC program, that we provided definitions and examples that we could then share with the participants. That really allowed us, when we were interviewing those people on the line staff, management, and even in leadership, to get a sense of where their time is being spent when they're working and how that may crosswalk back to one of these activity codes. We wanted to make sure that they understood that this program was worth their while, and really stress to them that we're not looking to have them change what they do. We're certainly not there to tell them how to do their job. It's a recognition that so much of what they do is reimbursable if they can just track that time in the MAC program. I mean, these are dollars that are really there and available for work that's already being done. So I just want to stress that. And I think that really was important for them to hear as well. That gives you sort of a lay of the land with the activity codes themselves. Everything we did on this project, we had an eye on making sure that it was not only helping them revenue maximize their drawdown, but that they were in fact not immune, but certainly well protected from audit findings in the future. So that made us really look very closely at the joint powers agreement, at the state plan amendments, at previous documents that they had for supporting their MAC claims in the past. So with that in mind, really one of the things that we spent a good deal of our time on was developing, well, here we'll call it a claiming plan, but it really in a sense was the MAC manual for CYFD, behavioral health, and juvenile justice. We were writing an instructional manual, which really laid out the time tracking approach we were taking, 15-minute increments, 12 activity codes, tracking all of your paid time. We wanted to make sure that we had the definitions of the activity codes and really good examples that were relevant to behavioral health and to juvenile justice included in that document, that we were going to show the approach that we were taking with the invoice. We created a brand new invoice template that we were going to utilize. And we worked in conjunction with CYFD, but also with HSD, which is the single state agency. And all the Medicaid claims are going to flow through your single state agency. In this case, in New Mexico, it was HSD. And they too, we had good communication links with them. They were very easy to work with. They reviewed our documentation. And ultimately, the plan that we put together for the MAC claiming guidelines, if you will, had to go to CMS. And they needed to review and go through that process of review and approval. And amazingly enough, from start to finish, it took less than 6 months. And that means developing the documents, talking with CYFD, working with HSD, the single state agency, getting their buy-in and making edits along the way, and ultimately going to CMS and their approval process. That was a very quick turnaround time. And I can speak from experience. I work quite a bit here in California, and we put together state plan amendments. We put together updated MAC claiming guidelines. And in California, to get CMS approval, that usually takes years, not months. So this was a very streamlined process. And it was very, very optimistic, and it was a very positive experience, and something that I would recommend. Don't be shy about trying something new in terms of getting this up and running in your own state. It did turn out to be quite a good process on our part within New Mexico. And I shouldn't say, I mean the royal we. It was CYFD, it was HSD and CMS as well.
Yeah, and I'll jump back in with some takeaways, but I also want to just emphasize the last point that Patrick made, which is, we said as a key takeaway before, understand the architecture, but I would also suggest don't be imprisoned in it. Meaning, if you need to rewrite it, go ahead and take that step. And that's what we did. We literally rewrote New Mexico's administrative claim plan for CYFD and got it all approved within 6 months. So for strategy development, the key takeaways here are familiarize yourself with technology vendors and strategies. No one who's listening to this webinar is probably unfamiliar with timekeeping and time tracking software. And there are some great ones out there. The ones that we use with Patrick called the Optimas Time Tracker autofills everything. So you put what you did and then you push autofill and it fills the rest. We had people down to less than 5 minutes a week completing time in the app. So understand that technology is a really important tool here. Understand the vendors. That's a key takeaway. Don't have people be filling out pen and paper stuff. It'll drive people crazy. Understand the current reform imperatives for the single state agency in child welfare, meaning design your revenue maximization work in the context of what these agencies want to accomplish together. So if you go back to one of our first slides, we said there was some really progressive leadership at CYFD. HSD was super aligned, wanted to support the child welfare system. So we were able to kind of frame this work in the context of what these agencies really wanted to do and sort of help them understand that these flexible discretionary dollars could help them do it. And then ground your work in your operations. An operational analysis of your divisions is always going to include payroll. You all have payroll. Some mechanism for submitting and tracking time. What is it? Would it suffice for a MAC claim? What do we need to do to enhance it? How are you assigning costs, and when can we distinguish the origin of the dollars that those costs are associated with? And what are staff doing? Like, do we actually know? And that's why we sometimes say that MAC is both a performance management tool and a revenue maximization tool. I'll kick it back to you, Patrick, for some more detail.
Okay, all right. So as we were sort of moving through the different stages here, I think one of the most important ones is really that stakeholder involvement. And we really, again, this program relies upon a heavy commitment and collaboration with a number of groups. And that means stakeholders in the form of the staff folks who are actually going to be the ones time tracking. They're going to be time surveying. They're going to be attending the training. And then also leadership. They want to make sure that this is going to be worth their while. And this is something that's relevant to what they do. So that was great. We conducted interviews with individual participants, with managers, with supervisors, as well as the leadership folks to really get a sense of what was going on a day-to-day basis. And again, how that would crosswalk over to a MA reimbursable or a MAC reimbursable type of activity. So we would go in, we'd give them a quick overview. We would define in broad strokes a couple of the reimbursable activity codes, and then basically say, if you were doing this, would it fit in with what your staff members are doing on a regular basis, and sort of work it back that way. So after we go through these multiple sessions with staff and with leadership, what we do is we sort of have a staggered launch approach to how we're going to implement the MAC program as it was approved by CMS. And that starts with on an April 1, which is, beginning of Q4 in many states. We had those behavioral health licensed staff, and those are those SPMP staff. There were 9 of them. And if you remember, I mentioned earlier, these folks were actually already engaged in the MAC program. They had been doing it for a number of years previously. So we thought it best to bring them in first. They had experience with it. They could then share some of their experiences with the Optimas Time Tracker, with our training material, with our help desk support, as we then moved to June 1 for the rest of behavioral health. So we added an additional 52 staff members from behavioral health at that time, and had them track their time and go through the trainings. And we wanted to make sure that the trainings were tailored for the different units. So we had different training material for behavioral health than we did for juvenile justice. We wanted to make sure that we had recorded training. So if folks couldn't attend one of our live trainings, or even if they did, they can go back and then review and go through a recorded one as well. And we also had a help desk that was available for folks who had technical questions. And those could take the form of an issue with the time tracker software itself, how to use it, username, login approaches, and if there were any issues or snafus there. But also if they had questions around activity codes, or if they called in and said, we performed this on such and such a date, how should we code it? We were able to take those questions and answer in real time. Finally, on July 1, we did the launch for juvenile justice. We had as many as about 173 people, a large group. in a brand new unit to the MAC claim. It went well, the trainings went well, and we felt that we had a really good start to this.
Yeah, so let me jump back in with some takeaways on stakeholder engagement. It's really important to have the senior leadership of the agency invested and engaged. And we had that both on the finance and the secretary level. And frankly, regular access too. So it's not just that, almost any leader of a public agency is going to want to go get more federal matching funds, but regular access in very efficient updating strategies like 15-minute meetings was really critical for us to get some buy-in at the senior level. We trained up and down the organization. And what I can say is that anybody who's running a Medicaid claim, be it direct service or administrative, if they don't understand what they're doing and why they're doing it, it won't go well. So spend time training both up at the top and have leadership buy-in, and then have line staff understand that what they're doing is helping bring more people to this work to help the vulnerable populations that they serve. Effectively crosswalking what people do to the language of MAC is really the secret sauce that Patrick brings, meaning taking a look at a duty statement and understanding how that crosswalks to particularly those 4 essential codes is really the key task of the strategy development phase. And then building trust among staff is just like essential. Like I said, it's really important for everyone from the top of the organization to the bottom of the organization to kind of buy into the entrepreneurial spirit of a project like this. Like, we're here together to be creative and innovative and bring more money in to serve the poor people that we are committed to. And then I think I would add as a final kind of key takeaway, what we say to each other is like, the first rule of any project like this is follow the rules. Following the rules does require an administrative burden, and it's important to not hide from that burden, meaning be super clear what it is we're expecting and be thoughtful and empathetic about what you're asking line staff to do. It's easy to say, oh, we're only asking you to do something 5 minutes a week, but that's too flippant. It's really important to honor the concerns of line staff and help them understand what we're asking them to do. Patrick, let's go back. Let's turn it back to you for the final piece of submitting the claim and getting the money.
All right. So really the final step is really focused on the claiming process itself. That means invoice development, invoice completion, and invoice submission. So we've gone through the training, we've trained on the time survey tracker, we've gone through the activity codes, help desk is responding to questions in real time. And what we're also doing is we're monitoring those time survey results in real time. We have somebody on our end who can get into the time tracker system, look at time survey results, send out reminders to folks who may be a little bit behind in tracking their time. And that helps as well. That's something you really can't do if you're tracking your time through like a spreadsheet. But through the tracker, we were able to do that. So we could also then see how folks were doing, how they were, and most importantly, just getting their time into one of the activity codes, making sure that they were fully compliant with putting all their paid time into those activity codes. So did that. Then we also created an invoice template that would take into account information from the time tracking system, but also from things like the payroll system, the general ledger system. When you are creating an invoice, you want to make sure that it takes into account that you can claim for direct services, absolutely, but also indirect costs. So it was a fairly lengthy document. You can imagine we're pulling payroll information from over 200 people for direct related costs. We're digging into general ledger information, trying to ascertain what can be included for the overhead or the indirect related cost, or the indirect cost, I should say. So that piece of it, getting that invoice done, we actually created a little bit of a training tool so that we could walk through folks at CYFD and through HSD so they fully understood what that invoice template was, how it was filled in, how it was compliant with federal rules and regulations. So we did that. We had that template, and it was our mission to get those invoices done very quickly. We typically got them done within 2 or 3 months of the close of the quarter. after the quarter closes, we go in, we pull data out of payroll, out of ledger, out of the time tracker, and then we're actually creating those invoices and getting them up to the single state agency and to CMS, hopefully pretty quickly thereafter. And then Alex touched upon this, but it's really important. We were also scheduling and had available refresher trainings for those staff participants on an ongoing basis. We didn't approach this from it's one training per year and we're done. We wanted to make sure, not just because people need refreshers, but as you can imagine, staff members, some people leave their units, they go on, they hire new folks. We wanted to make sure that those new hires were aware of the process, of the activity codes, of the time tracker, and got trained very quickly thereafter. So what you're looking at here is the fiscal year 22 quarterly invoices for both behavioral health and for juvenile justice. We felt that we had exceeded what our expectations were for the MAC program for these folks, which was wonderful. We came in at just over $3.9 million for the whole year, pretty evenly divided between behavioral health and juvenile justice, about 1.96 for behavioral health, about 1.94 for juvenile justice. So this was wonderful. I think it was a really good result. We actually had 2 more quarters past that, which also had very good results as well. I'll let Alex take this, but yeah, this is important as well, these takeaways.
Yeah, and just to repeat what Patrick said too, like we projected 2 million and we ended up with almost 4. So I want to say, and I saw a great question pop up in the chat from Rosie about, how do you control for, like, are we trying to catch staff for doing wrong? And that's really why it's important for senior leadership to talk about this program in the right way, meaning it's not an accountability tool, it's a revenue maximization tool. We're all in it together. And one thing that is an important takeaway is reimbursements can take time. They are often subject to delays. And while the reimbursements in this project did move quickly and effectively, we're very grateful. It's important to manage expectations that you may be waiting 12 to 18 months, particularly for your first claim. After that, they go a lot faster. The second takeaway, and I can again just say this, having led a system for more than a decade, persist, persist, persist. It gets better over time. As you saw in our previous chart, our claims grew and grew as staff understood what they were doing, were more able to crosswalk their time, got some texts and emails and updates from the help desk. And so that means continue to monitor and train. Number 3, it's maybe not the sexiest of work, but it's really important work. And it doesn't take a huge amount of time. But as people get better at it and as they persist at it, your revenue will grow. And build internal capacity, meaning we were very careful to not create a culture of consultancy, meaning CYFD became expert in this work. And it's important for public systems not to farm out the expertise here, but go ahead and invest and learn it. It's not that complex. Spirit guides like us are important, and we're happy to work with you to take you through the process. But ultimately, building your internal capacity to understand, manage, and process these claims is completely doable. So I want to end with first, most importantly, gratitude for the NEKC Foundation. I can just say personally, I grew up in one state, in one county system. And so doing this work elsewhere was an extraordinarily good professional opportunity for us. We're very happy with the outcomes, but we're most grateful to CYFD and their entrepreneurial leadership and their willingness to innovate and push and adopt work that has made a big difference to them from a revenue perspective. And as well, the collaborative competence and will and skill of the single state agency. So I think leadership and finance staff across both essential actors, the child welfare and the Medicaid agency, were aligned and collaborative and willing to grow and learn and invest. And we could not be more grateful. If you want to know more about us or reach out or talk about it, we're kind of weirdo. We think Medicaid is sexy, and we think this is work that should happen all over the state and nation. This is your money, y'all. You are spending the non-federal dollar. You are eligible for the federal match. We would like to see nothing better than child serving systems get more sophisticated at this and learn how to get these dollars so you can spend them in the way you think is best for the young people and families that you serve. And with that, I will pass it back to our colleagues at Annie E. Casey to facilitate some Q&A. Thank you for listening.
Thank you, Alex and Patrick. Really great to hear this overview from you all. And I'll say from the foundation, part of the reason we were so excited about today's webinar is, we're thrilled about the success of this work in New Mexico, but we also think that there are great opportunities around the country in a number of jurisdictions where we work to maximize MAC claiming and think about how that can be used as one fiscal strategy for advancing an overarching set of priorities related to the well-being of young people and their families. So that's exciting and really grateful for folks who have joined in today. I'll just highlight a couple of questions that I see in the chat and through the Q&A in the time that we have left. I think I would start recognizing that we have many folks who are joining who may not be sitting in a fiscal leadership role within state agencies. I would start by asking you, what would you suggest for someone who is a community advocate or a professional working outside of the system or a professional within the system without fiscal strategy expertise, working in another jurisdiction, curious to know about, how I could start to explore what the opportunities are here? Where would you point folks to start to learn more?
I very much appreciate this question. I want to say I am, my background is in emergency room social work. I'm a therapist by training. I came to this work by listening carefully to amazing leaders like Patrick and a mentor of mine, Vanna Chavez, who was the finance director of the agency. So one is meet and understand and become friends with those finance staff and leadership because they have great wisdom and intelligence that you can benefit from. But then I think demystify, meaning begin with the simple idea we have offered, which is where are public dollars being spent that are not federal? You don't necessarily have to know how to get the federal match. You have to really focus on where am I doing work that is publicly supported where there isn't a federal match. And then with an open heart and open mind, start talking to finance people about what might be possible. That's my recommendation. Patrick, anything to add there?
I think it's a really good question. I do think it's going to vary a little bit, probably from state to state, depending on how the rules, because how Medicaid operates is as a joint program between the federal government and the state governments. Rules and regulations can vary a little bit, but I think New Mexico is a really good example of it is vital to get state leadership involved, local government leadership involved, and sort of working that process along. I do think there is a lot of opportunity to grow MAC programs outside of the traditional health department model. I think it's been sort of entrenched in. So child welfare, juvenile justice, which was not a traditional unit that was associated with MAC claiming. Yeah, that's what I would add.
Thank you for that. I have another question, a little more granular, specific to juvenile justice functions within agencies. So we have one question in the Q&A that's saying in their jurisdiction, they don't believe that their state bills or leverages Medicaid for anything in the juvenile justice space at the county or state level. So there's a curiosity about what sorts of services or efforts could be considered related to Medicaid or MAC related to juvenile justice.
Yeah. So this is a really big, first of all, very welcome question, and a very big area and a really interesting one from an advocacy perspective because the landscape is changing. Historically, if you were a resident of a correctional facility, meaning you were actually living in a locked facility, you could not bill Medicaid. That was something called the inmate exception. Beginning in 2025, that law is changing. So I just want to say some really big policy changes are in the works. But even when you separate out kids in detention, all of your community probation work is a potential opportunity for MAC claiming. Your prevention work, your community supervision, even your probation staffing can bill MAC the same way that CYFD did. And the same, Patrick has a number of examples of that from California as well. So when young people are not in detention and they're living in the community, either under supervision or in prevention programs, those are extraordinarily good opportunities to claim federal matching funds on the services that are being funded and provided. I'll leave it there. There's a lot more technical stuff I could go into, but remember, the vast majority, between 85 and 90% of children involved with the juvenile justice system are eligible for Medicaid.
Yeah, and I think specifically to Texas and their single state agency, they have an active MAC program. May well be the case that juvenile justice is not currently claiming through that, but it is an option. One thing about MAC to keep in mind is that it's not a direct service program. It's really about a time survey specific kind of program, and you don't have to have certain licenses or certifications. It's open to departments well beyond health. So that's why in California, we've got probation departments that are claiming MAC. We have probation departments that are claiming targeted case management, which is also a possibility. And just to give folks a sense of what I'm talking about, if you have people who are working and, they're talking to clients, they're working with clients, they're linking them with healthcare services, right? They're managing those services, making phone calls with providers, following up, having a case plan. I mean, many of these types of activities are reimbursable through either the MAC program or the targeted case management program. And again, it's not just for nurses or doctors. It's much more broader in scope than that. And we have folks here. Targeted case management allows you to claim not just for case management as it relates to a healthcare services, but a whole person approach. So when you're managing things like social service needs, housing navigation, food insecurity, these kinds of activities are also reimbursable and through the TCM program.
Patrick, let's repeat for everyone to be listening.
Yeah.
There is no licensure requirement to claim MAC.
None. Yeah.
None. So, and remember, it's not associated with an individual beneficiary. It's associated with time on task.
Right.
And it's not restricted to health departments, even though that's historically where it's been focused.
Thank you for that. There's related to timekeeping. I'll just ask a few more questions as we wind down our time together. So there's a question from Beth around the time tracking work and whether that was focused on state agency staff or providers that contract with the agency. And I think I would kind of add to Beth's question to say, beyond what was done in this project in New Mexico, how could participants think about that in the context of systems that are partially privatized, where they're looking to agencies to hold a lot of those sorts of functions?
Yeah, two really good questions. I mean, for the project that we did with New Mexico CYFD Behavioral Health Juvenile Justice, it was exclusively focused on state staff, basically employees of behavioral health and juvenile justice. But that's a limitation that we put into the project. MAC programs can allow for contracted staff, CBOs and so forth, to participate in the program. There has to be a mechanism that's sort of written into the rules of the state, but it's not uncommon at all. Again, just referring back to California, we have a number of community providers who are in the MAC, MAC-related programs and are claiming FFP either through their county government or in some cases directly through the state agency. And so that's a definite possibility. Yeah, and we certainly have examples because the way the county model oftentimes works in California is that a lot of the county is pushing out, they're contracting many of their services to contract providers. So yes, the program is available to contract providers.
Thank you for that. And one other question that I think others might be wondering about, can you say a little bit about the time frame from beginning to end in terms of receipt of funding, and also any parameters or guidance around what the state, around limitations for the use of the funds after reimbursement?
I'll start, but I'll pass it off to Patrick. It can take a long time. CYFD was really fast. So I just want to say, we have projects where it's taken 12 to 18 months to get our first payment. So that's one of the reasons we were pretty focused in one of our takeaways to manage expectations. about the revenue cycle issues of getting your payment. So it's a long-term strategy. This isn't something to fill your budget next year. It's something to build a permanent revenue base that will grow over time. So it's not best for crisis work. It's good for long-term capacity building work.
Yeah,
Let me stop there.
Yeah, I mean, I agree with Alex. In California, the payment's taken a little bit longer for those MAC programs. There's some variation. In California, we have multiple MAC programs, one that's directed for schools, mental health departments, other agencies. The New Mexico timeframe was much faster. Within a few months, I believe, payment was being made to CYFD. So I think he's right. Alex is right to sort of emphasize the fact that don't go in assuming that you'll submit a claim and a month later you'll get payment. It will take some time, more than likely, and you can build on that for the long term. Yeah, and so I think one of the questions that sort of came up was, when those reimbursement dollars come back, are they sort of discretionary in nature, or are they earmarked for specific types of costs? And the answer is they do come back as discretionary dollars. They can be utilized how you see fit. Now that there's some nuance that I should add to that, because if you are a community-based organization, it may be the claim comes through a government agency and then they may have their own rules and regulations. But by and large, those federal dollars, when they come back through a CPE program like MAC, they are in fact discretionary, and they can be used as the agency sees fit.
Thank you for that. One last question. What can you share about, really a two-part question. One, what can you share about the capacity capacity that is required to undertake this strategy? And then also ask, and just closing, if there are any, do you have any recommendations for resources or publications that are available that folks could read more, or feel free to share those as well.
Yes, I think if you're a public system or advocates, it probably makes sense to have some spirit guide during the process we laid out. And that either means partnering with philanthropy or doing an RFP for a consultant. And I think that process is somewhere between 12 and 18 months long and should be focused not on permanent consultancy. I just want to kind of say this again as a public system leader. It's important to not just farm out this skill and capacity, but to invest in your own organization's ability to grow and manage the claim over time. So the question was, what does it cost, I think, and what does it take? And I would say 12 to 18 months, maybe 12 to 24 months of a consultant's time, probably a couple $100,000 to get you to a specific projected claim and an approved claim plan would be my ballpark estimate.
Yeah, I think I think I agree. I do think it's going to take some time to get something up and running. Hiring an outside consultant could be one approach, with an eye towards building the internal infrastructure to maintain the program on an ongoing basis, because you're still going to have the need to have staff trained. You're going to still have invoices created, audit documentation maintained and updated, and the potential to get questions from both the state agency and the federal government. So make sure that you're sort of moving towards that in terms of your supporting documentation and supporting infrastructure. Yeah, I mean, it's doable. I do think it's very doable. I think people have been a little bit hesitant because, again, there's sort of this, calling it myopic's a little strong, but we've had this idea with MAC and targeted case management and programs like that, they're directed towards health departments, where it's much, much broader than that. But yeah, I definitely think that's true. We've certainly seen counties and other government agencies that have successfully implemented, after a couple of years, putting together a good infrastructure to maintain and grow their program for years to come.
Patrick, if I could just say, on the question also included documents and resources. One is this deck, of course, is available and free. The foundation paid for it. We'd love to see it distributed. You can use it. You don't have to cite it. Go team. Second, almost all MAC, in fact, all MAC guidance ties back to a 2003 CMS letter. We will ensure that is either linked in the chat or distributed to all attendees. it's a good source document to know, like actually read the thing. It's what the feds say you can do. And then it's really important to actually look at your state administrative claiming plan, like pull the actual document. That was one of our initial recommendations of understanding the architecture of Medicaid in your state. And if you're not sure how to do that, give us a call, we'll help you.
Thank you so much, Patrick and Alex, for your remarks today, but more importantly, leading this work and with New Mexico and nationally. Really grateful for you all as partners. And to everyone who joined today, thank you for your excellent questions. Many folks asked whether today's session is being recorded and whether the materials will be available. So yes, today's session will be recorded. We'll make sure that's available along with the deck and the source documents that Alex just referenced. This concludes our time for the webinar today, but thank you so much for attending and for your excellent questions, and have a wonderful day.
Thank you.
Thanks, everybody.